The leg bone's connected to the knee bone. The knee bone's connected to the thigh bone. Hey guys, today we're going to be looking at the last component of the ITBS / runner's knee series that we've been looking at for the last few weeks, and that's how to prevent runner's knee to begin with. If you remember in the first video, we talked about exactly what ITBS is, the iliotibial band syndrome, and where that hurts on your knee and kind of what causes the problem. Then last week we looked at what you can do to help alleviate the symptoms, things that you can do that maybe you've heard of before that maybe aren't as effective, and then some treatments that are better effective. If you missed any of those two videos, I definitely encourage you to go back and check them out and get kind of the full picture of ITBS, runner's knee, and how to deal with it. And today, like I said, we're going to look at how to prevent the problem to begin with. The biggest thing that you can do for preventing iliotibial band syndrome and runner's knee is to make sure that your core and your hip musculature is strong. That's where the muscle is that's connected to the IT band is. And if you're unstable or not as strong as you need to be in those deep hip muscles, that muscle has to work overtime, puts extra strain on the IT band, which puts extra strain on your knee, and then you've got a problem. So what are some exercises that you can do to help to make sure that those muscles are strong? When it comes to strengthening the hip musculature, there are two great exercises that you can do and you can incorporate right now. You need no equipment. All you need is a little bit of space on the ground. And those exercises are the fire hydrant or the clamshell. Both of those exercises work your deep hip rotators, which again are going to help to strengthen your hips and take some stress off of your psoas muscle, which is connected to your IT band. The other group of muscles that you need to strengthen to prevent iliotibial band syndrome are your core muscles. And just to be clear, when you're talking about your core muscles, you're not talking about just your abs so much as all of the muscles of your core. So your abdominals, your obliques, and your lower back. A couple of great exercises for those muscle groups are planks, both standard planks and side planks, as well as bird dogs, because those exercises force you to engage all of the muscles on your core, as opposed to doing back extensions or ab crunches, things like that, that really focus only on one muscle group or the other. Anybody that's ever had runner's knee knows that it's no fun. And as somebody who's dealt with these problems before, I promise you that preventing the symptoms is so much better than having to deal with them. So remember the old saying, an ounce of prevention is worth a pound of cure, and it definitely applies when it comes to runner's knee. So take the time, a couple times a week, do some of these exercises, get on that foam roller, and hopefully you'll never have to deal with an issue of runner's knee ever again. Them bones, them bones, them dry bones, them bones, them bones, them dry bones, them bones, them bones, them dry bones, them bones gonna walk around.